you don't already know how to use this book in nursing school, you're wasting so much time and money. So let me teach you how to use it. First off, there is a brief overview of how to use the book in the beginning, so you don't have to learn everything, but it's quick and easy to use. It's a reference book. It's not a novel, so you don't have to worry about reading the whole thing. It's split up into sections. Section 1 gives you some information about using the nursing process. You don't actually have to read this if you don't want to, but if you're having trouble knowing what information to assess when you're actually with your patient during clinicals, then this can be a really good guide to helping you out with that. It even includes some case studies so you can learn by example. But if you're just trying to get your care plan done quick, then section 2 is where you want to start. This has a list of all kinds of different problems that your patient might have. So you can see alopecia, which is a type of hair loss, allergies, alcoholism, and it's all alphabetized. So congenital heart disease, congestive heart failure, right? Conjunctivitis. So whatever. It might be a nursing diagnosis. It might be a medical diagnosis, or it might be a symptom, but you can look through and you can find it here. Okay. And so once you go with that, then you will say, so let's just say, let's look at something like COPD, chronic obstructive pulmonary disease. You can see now it's going to list a bunch of suggested nursing diagnoses that are often associated with this particular issue. And it could even be something let me see, if you're doing pediatrics, maybe you see croup. And if it's croup, for croup though, it gives you other suggestions. So not croup, but look for respiratory infections. So then you can just look up in the same section to look up for respiratory infections and get it there. Let's go back to COPD and we can pick one of the nursing diagnoses, let's say impaired gas exchange. It also gives some related to, so we can say, related to ventilation, perfusion, and equality. And then if you want to say as evidenced by the AEB, then you would go back to whatever assessment data you had. And you would just plug in the symptoms or the self-report or the vital signs or whatever it is that makes you think that this would be an appropriate nursing diagnosis for your particular patient. Then you look up that nursing diagnosis in section 3. This is where you get the detailed information, more information about what you should put into your nursing care plan. So you have more characteristics, more risk factors if needed, all this great information. You don't use it word for word, but you use it to pick and choose what's appropriate for your particular patient. And then it has a whole ton of nursing interventions with rationales. And when they have them available, they even include all of the different original research articles where they get that from. I'll do a part 2 to address some common concerns when writing care plans using this book.